Channel 14, CSU News, where we break complex processes into basic concepts. Good morning, and welcome to Channel 14, CSU COP News. Today's special report is about respiratory alkalosis. I'm Brad Van Huysen, and in the studio with me is the wonderful
Jamie Brown. And so today we're going to, like Brad said, be discussing respiratory alkalosis. It's the most common acid-base imbalance in the critically ill. It is associated with many different illnesses. It's common in patients on a ventilator. Many cardiac and pulmonary disorders do present respiratory alkalosis as an early sign. The cause of respiratory alkalosis may be minor, or it could be very severe. All acid-base imbalances are determined by a ratio of bicarbonate to carbon dioxide. The normal ratio is 20:1. Anytime that ratio falls below 20:1, it creates a situation of acidosis. Anytime it rises above 20:1, such as in the case of alkalosis that we will discuss today, it's like I said, it's a situation of alkalosis.
There are two forms of imbalances in the respiratory alkalosis and acidosis, which are created by an abnormal amount of carbon dioxide. And there is a metabolic alkalosis and acidosis, which is created by an abnormal amount of bicarbonate that is generated from non-carbonic acid. Respiratory conditions can only be corrected by the renal system, and metabolic conditions can only be corrected by the respiratory system. For more information on respiratory alkalosis, we go on location now with Tara Gilman.
Now on to more information on alkalosis. These are some of the causes of alkalosis. Respiratory alkalosis is what we're looking at today. Mood, medications, or mountains can cause hyperventilation, which decreases the blood CO2 levels, which in turn causes alkalosis. This in another way is saying that you have apnea, where you can't breathe.
I'm Sweta Patel, and now we are going to go over respiratory alkalosis. Look at my friend. He's breathing too much. Why he's doing that? Look at that. He's exhaling too much carbon dioxide. Look at his eyes. Oh my God. Now he's going to lose CO2 by hyperventilation. Why he need to do that? Oh my God. This is physio. So I cannot explain him what he's doing. But since he is losing CO2, so by losing CO2, it's going to cause hypocapnia. And look at that. It's going to cause loss of H2CO3 because we don't have CO2. So how are we going to produce H2CO3? And if we don't have H2CO3, then we are going to lose H plus and HCO3 minus 2. And because of this, it's going to cause increasing pH. And we know that increasing pH means respiratory alkalosis. So it's going to put my friend into worse condition. But if we want to know why this caused what causing my friend's worst situation, we are going to go to next step. Let's go to channel.
Thank you for joining me back in the studio here. As you can see here with the cell, we've got a lot of hydrogen in the cell, and outside of the cell, we've got a lack of hydrogen, or an excess of bicarbonate. And as Sweta had shown us, that bicarbonate is causing the alkalosis. So hydrogen is being pulled out of the cell at a 1:1 ratio, and potassium is being put into the cell. And the hydrogen bonds with the HC3O, causing the H2CO3. This continues at a 1:1 ratio. And as the potassium increases in the cell, and the hydrogen increases on the outside, causing the H2CO3 to increase, you can join me over here. The buffer system in acid-base balances is extremely important. The carbonic acid H2CO3 dissociates to hydrogen and bicarbonate HCO3 negative. In the situation of alkalosis, bicarbonate HCO3 negative is high in the bloodstream. And when the hydrogen is pulled out of the cell, it bonds with the bicarbonate to produce H2CO3. As the H2CO3 increases in the bloodstream, that lowers the pH, it decreases the bicarbonate, it also decreases the serum potassium levels and causes hypokalemia in the bloodstream. The increase in the potassium in the cell decreases the membrane potential, later on, as we talk about alkalosis, you'll see how that makes a difference. I'm going to go ahead and send this over to Brad, and he'll take you through the next step.
The acid-base balanced buffer system in the body not only affects the blood, but also various structures, with an increase in pH and a decrease in the partial pressure of carbon dioxide, leading to respiratory alkalosis. This not only affects the medulla oblongata of the brain, but also the stimulation of the aortic and carotid bodies of the heart, leading to an increase in heart rate, but not pressure. This decrease in the partial pressure of carbon dioxide.
Did someone say decrease in carbon dioxide?
Hi, Phoebe.
Hi, Brad. Over here, we'll talk more about a decrease in carbon dioxide in the plasma, which is called hypocapnia. What is hypocapnia? Why do we care? Well, hypocapnia causes a vasoconstriction of the capillaries that take blood into the cerebrum. When there's a decrease or vasoconstriction in that area, it causes a decrease in blood flow to the brain. It also causes overexcitation of a portion of the brain, the medulla and the pons. When this happens, there are some things that you have to look for, things like anxiety, dysphoria, dysphoresis, dyspnea, apnea, hyperventilation, dizziness, tingling in the fingers and the toes, or the toes. So, when you have that exam anxiety, maybe it's due to hypocapnia. I don't know. We'll see. If this persists, though, there are things that you got to watch out for. So I'm going to transfer it over to Tara in the studio. Over to you.
I'm here to explain what happens if you have continued hypocapnia for 6 hours or more. Your body starts to accommodate. And what will happen is that the kidneys will begin to increase the secretion of HCO3 into the peritubular capillaries, and at the same time decrease the excretion of H+ into the urine, which both of those together will increase the plasma concentration of H+ and HCO3- to try to accommodate. And what happens when that happens is your body begins to have patterns of apnea and hypoventilation at the same time, which is patterns of deep breathing and then patterns where you can't breathe at all. Kind of like this girl. Let's get her to the hospital.
That was a close one. I will be talking about the last step of alkalosis. As we all know, alkalosis, an increase in alkalosis, which is a loss of H in our cells, leads to a decrease in concentration of Ca concentration. This is because the albumin protein in our bodies, it tends to take up all the free Cas that's around it, which leads to a decrease in voluntary muscle contraction and an increase in involuntary muscle contraction. This, as Jamie had said before, an increase in potassium levels and an increase in sodium levels results inside our cells because of the decrease of the Ca levels outside the cell. This leads to greater potential for action potentials and increase in nerve excitability. This overwhelms the central nervous system and the heart, which leads to other diseases such as a decreasing level of consciousness, tetany, which I had explained right here, arrhythmia, seizures, and comas. Now we'll take it back to Brad and Jamie, back to the studio to conclude our...
Thanks, Rucha. I hope everything's okay. Briefly, I'll go through one of the three remaining conditions into how they are created and how the system compensates for them. One condition, respiratory acidosis, which is an increase in carbon dioxide from hypoventilation where bicarbonate levels are normal. This causes more of the hydrogen ion to be created. Possible causes for this include lung disease, drugs, nerve or muscle disorders, or simply holding your breath. Compensations include chemical buffers which take up the excess hydrogen ion, kidneys conserving bicarbonate and creating more bicarbonate, or kidneys secreting and excreting more hydrogen ion, which causes the bicarbonate to increase, restoring to normal pH. Thank you from everyone at Channel 14 News, CSU.
Making learning just a little bit easier.